and I'm gladly giving the floor to Margarita.
Okay, thank you so much for your introduction. I hope you can hear and see me, and especially the screen that I'm sharing now. Just before I begin to show you the results of our study, so let me just give you a couple of introductory words. First of all, I know that we're all sick and tired of COVID-19, so I mean, like, literally and physically, I think. So, but I'll try to give it a little bit different angle today in my talk. So, and another important disclaimer is that I'm combining two empirical studies, two future papers, I hope so. So one is already under review and another one is still in progress. So, and it seems to be like a whole pipeline based on this series of online panel surveys we're carrying right now together with the LCSR at the High School of Economics in St. Petersburg and Moscow. So it looks a little bit like an old saga. About a year ago, even longer, even more, actually, we started with the questions about how will the pandemic affect political support in Russia. So it's something that lies on the surface. And we didn't expect like anything intriguing, because usually when you explore political support in Russia, so the main correlates are either economic indicators, and when it comes to individual level analysis, so it produced more, I would say, not dodgy, but like more noisy results, so to speak. But this time we found out something extremely interesting, and actually it doesn't seem to be a statistical artifact. So this is something substantial, and it really requires, I would say, a more thorough investigation. So this is the role of COVID dissidents or skeptics. I am going to use these two terms interchangeably during my talk, but actually it's not the same. So, and there is a whole literature line behind it that skeptics are those who kind of believe that virus is real, but it has either artificial origins or the way actually it has spread was intentional and malintentioned, and so on and so forth. So, and those who actually are dissidents, they even do not believe in the very existence of virus. Or going back to skeptics, so they think that virus exists, but maybe it's not actually even more dangerous than a normal flu, things like that. So, but again, in this presentation, I will use these terms interchangeably, which is not entirely correct. The whole research, again, as I said, reminds the whole saga. So we started with the question, so what are the determinants of political support in the times of pandemic in Russia? So, and of course, we started with the so-called scandal around Levada and the number of Russian mass media who actually reported this historical minimum of 59% in April 2020 last year. So, and we got puzzled whether it's a long-standing, I would say, process, or it's just like one outlier and the degree level of political support will go back to its normal level. So, and here we can see the graphs from Levada Center. It's from their website. So I'm sorry, it's in Russian, but I think most of the audience here actually can read Russian. So this is the
Margarita, I'm sorry, please share your screen.
Oh, okay. So that's good that I didn't run too far. So here we go. Can you see that?
Yes. Yes.
Okay, good. So, and here is the graph, actually, I tried to describe a couple of seconds ago. And what we got curious is the ending of this graph. And so this is basically the fluctuation we started with. So that's the research puzzle. When it comes to the political support and its dynamics in the times of pandemic, because the pandemic is an example of a so-called exogenous shock. So we addressed the academic and theoretical literature which exists, and actually, because this is not the first epidemics actually the humanity faced. That's the first thing, and this is not the only exogenous shock actually the humanity also had to deal with. So this is why we kind of combined the existing literature into three blocks. The first block is the so-called rally around the flag effects. So basically the idea behind is that if there is anything, if there is a natural disaster or any other kind or technological catastrophe, so basically it produces a so-called rallying effect, because usually existing governments are not responsible for these events, and basically they are dealing with what they have. So like Fukushima disaster in Japan 10 years ago and things like that, or the Russian wildfires in 2010. All these events cause the so-called rallying effects. And when it comes to the pandemic, like going back to these times, so this is what we observed in Finland, because the political support for social democrats has skyrocketed. The same was observed for South Korea, which actually, apart from the pandemic itself, basically coped with the crisis quite successfully. But on the other hand, there is a contradictory evidence provided, for instance, by the USA and a number of other countries, or the UK. So where we do not observe any rally around the flag effect. So, and even we observe something which is actually looks like the opposite. So this is called the hyper accountability effect. When during the times of exogenous shocks, people tend to blame the government for inefficient response. So actually, basically, do not respond to the event itself, but to the subsequent actions undertaken by the government. So this is why we actually already see some kind of a debate in the existing literature. The second block is I would say, collection of individual and country level factors that also tend to correlate with political support in the times of exogenous shocks, or like perfect storms. So the first indicator is the degree of political polarization. And usually if a country is more polarized politically, the rallying effect is lower or even absent. So, and Hans-Peter Kriisi and his team, actually, they already found some evidence based on the panel survey they're carrying right now. So the second indicator is the institutional design. Here, by institutional design, we mean either it's majoritarian institutions or proportional representation institutions. So under more consensual institutions like PR and parliamentary democracy, we observe higher rallying effects, and the other way around. So if we are dealing with a country with majoritarian institutions, basically the rallying effect is lower. But this is actually holds true when it comes to Western Europe. So what's going on in other countries beyond this area? So there is still a lot of debate, and there is no coherent empirical evidence. The third factor is the impact of negative economic experience, including job loss or the shrinking working hours, or living on the welfare and things like that. So basically, all negative economic experience has to affect somehow the degree of political support. So, and usually here we actually rely on the classical retrospective economic voting models. If anything bad happened in economic terms, people tend to be more skeptical about the existing government. And finally, there is another evidence that actually shows that those who experience the negative events, not economically, but physically, so to speak, when it comes to natural disasters, or when it comes to the pandemic, who actually was diagnosed with COVID-19, or who actually suffered from it, or whose family members suffered from COVID. So these people actually had to deal with public services, including healthcare sector representatives. And basically those who actually dealt with them, they tend to actually blame the government less, but only under the condition when the governmental response was relatively sufficient. So this is basically what Becker and Heinmüller found back in 2019 based on some evidence during the floods in Germany. So, and we also, my colleagues from High School of Economics, 10 years ago, including my co-author Boris Sokolov, Yegor Lazarev, and their co-authors, they found the same effect during the wildfires in the central part of Russia in 2010. So those people who actually suffered from the wildfires, they tend to trust Putin personally and appreciate the government somewhat higher than the rest of the population. Again, but COVID-19 is not a usual exogenous shock. So it does have a number of features that clearly differentiate it from other kinds of natural disasters, or I don't know, external economic crisis. So, and these features are as follows. So the first one is that there is no single triggering event, so which actually fails to produce a kind of a unifying, emotionizing experience for large numbers of people, because the pandemic was unfolding relatively gradually, so to speak, and kind of geographically unevenly. So this is one thing. The second thing, it doesn't have a clear localization, so it's everywhere and it's not visible. So usually those who are sick. We don't know whether they are sick, and even most of the people who experience COVID even are not aware of that. It can actually go without any symptoms. And finally, there is a thing which is called issue fatigue. So basically, the overall, excitement, or not even excitement, it's not the right word, right, to describe it, but I would say attention to the event was much higher about 1 year ago, and now it's clearly that people are tired of this issue. So, and mass media try to report less on that and things like that. So basically, it doesn't have this kind of a unifying rallying effect, and it produces uneven consequences for different people. So this is why putting all these findings from previous research and special features of the COVID-19 pandemic. So we do not have clear, straightforward expectations how actually it would affect the degree of political support. But one thing we can tell is that it's far from being straightforward. What kind of empirical data we're relying on? So this is a comparative project which is called Values in Crisis, led by the World Values Survey, Christian Welzel and his team. And we are actually represent the Russian field. So together with Boris, Aygul Mavletova, and Edward Panarin. This is the online panel survey. So for obvious reasons, it's online, it's not offline because of the quarantine measures. I will rely on the evidence from the first wave, which actually was carried out in the beginning, actually mid-June last year. So it's been a while. It's just the beginning of the pandemic, or the end of the first wave in Russia. The number of respondents is 1,527 respondents, and those are only Russian citizens aged over 18 years old, and we based our sampling procedures on age and gender quotas. So it's not an ideal representative sample, but we did compare the results, the distributions with other surveys, and it looks pretty coherent. So there is a number of biases which actually can be tackled quite easily. But if there is anyone who is interested in what kind of biases and inconsistencies we have, so I'm more than happy to comment on that. And apart from Russia, we also have 11 countries in one territory, which is Hong Kong, a kind of representative of China. Unfortunately, we do not have representative data on China, which actually would have been extremely interesting. We do have data on Georgia, Greece, Brazil, UK, Germany, South Korea, Austria, and Sweden. So hopefully we will have more countries in next wave. And actually the second wave will be carried out, at least in Russia, in April. So, and I guess in June we will be ready to actually compare our results with the second wave and carry out a panel data analysis. How do we measure the phenomena of the fact of experiencing COVID-19? So basically, we take the share of respondents who were diagnosed with COVID, and as you can easily guess, the percentage was pretty low. It was just 1.4% back in mid-June 2020. So this is why we decided to extend the share of people who actually had to deal with COVID. So by adding those who reported some symptoms, including moderate symptoms, mild symptoms, or like COVID or flu-like symptoms, because the diagnostics were not that available back in June. So this is why we might think that this could be COVID. So, and this makes the share, the notion of experiencing COVID a bit more inclusive. So it ends up, leaves us with 6.9% if we add respondents whose family members were diagnosed with COVID. So in the end, we have almost 13% of the sample who reported that they experienced COVID one way or another. Another important feature of this wave is that we have 5.7% of no response. So, and this actually considers a pretty high non-response rate, which might actually tell us that this issue can be sensitive, or some people actually were unwilling to talk about the issue. So I will just leave you with this number here. So for a while, and but I think it's honest if we report this issue to the audience. But actually, this is something we cannot really change, and we have to deal with. How do we measure political support? So we are using the number of conventional indicators, so which is the trust in government, trust in national healthcare system, then trust in political institutions overall, and finally, to what extent respondents think that the government dealt with the COVID-19 effectively. So these four measures actually tend to correlate quite dramatically, but there are some deviations. So, and here are the results without any further ado. So this is actually how our distributions look like depending on the COVID experience on x-axis and the level of political support between different groups. So, and as you can see, so the confidence in government or trust in government, here again, we're using this term interchangeably. Confidence in healthcare sector, confidence in the country's institution as a whole, and government's efficiency, effectiveness. So basically there is no difference. So all the bars look quite the same. If we look at the gray bar is in one way or another, so in the confidence in government, the gray bar is a little bit higher. So which means that the degree of trust among those respondents who actually decided not to give any answer is a little bit higher, but again, so it's just 6% of the sample. And again, it's a little bit lower when it comes to the evaluation of all political institutions. So, but again, in terms of statistical significance, these differences actually are negligible. So, which means that there is no direct or straightforward correlation between experiencing COVID and political support. So this is the first, I think, important finding we have so far. So again, if you or anyone in Russia had a COVID, so it doesn't mean that their political attitudes or political support has changed. That's one thing. Then the next usual suspect is a negative economic experience and actually how it interact with perceptions of COVID. So here we use a dichotomous indicator, which is a combination of different types of negative economic events, which is job loss or bankruptcy, if we're talking about individual entrepreneurs, or switching to a part-time job. So, and in the end, we are left with 22% of respondents in our sample. This is a little bit less to the samples provided by FOM, for instance, another state-funded survey polling organization, polling agency in Russia. But still, these numbers are pretty comparable. And then we also introduce another indicator, which we coined as a COVID skepticism. Actually, I'm using different spelling systems, so either K or C, so it depends. So my author has a strong preference towards British English. I do have a default American English. So if you see different spelling, so you know actually who actually wrote which part of the presentation now. We also use another indicator, which was formulated in the question items such as the social media are full of stories telling that the corona pandemic is a hoax and that all the lockdown measures are a hysterical overreaction. Do you believe in these stories? This question actually aims at grasping those COVID dissidents or COVID skeptics we are interested in. So, and let me show you the distributions. So here actually how the negative economic experience in the way we measured that is correlated with political support. And again, so I will not actually comment every single number because it's pretty clear that there is no effect whatsoever. And this is, all these differences are statistically insignificant. There is a little bit of a variance here in the graphs that actually the bars that show the difference, the mean difference between those who actually experience negative economic, report negative economic events and actually the degree to which they think the government handles the corona crisis effectively. So here are some differences, but again, these differences are not statistically significant. So the confidence intervals actually do overlap. And finally, the most intriguing part, this is the end of the first series of our saga. So basically the main predictor and which produces the largest effect is the correlation between those who think that coronavirus is a hoax. And actually this is how it affects the level of political support. So again, this is not the dynamic situation. So we don't know whether these people were skeptical about Russian government before the pandemic. So we actually cannot attribute this to the pandemic itself. But this is basically what we registered in mid-June. And it seems that this is, first of all, our first interpretation was, okay, maybe this is an aberration or something went wrong in the data and things like that. But then other surveys also reported a relatively high not even relatively, pretty high level of COVID dissidents in Russia. So, and this is why we decided, okay, this is something very interesting that we really need to go into this direction. So basically those who think that the coronavirus is a hoax, they tend to distrust the government more. So, and it holds true for all 4 indicators. So, and these differences are statistically significant. If you think that Russia is special, so to some extent, yes. And if we compare the share of COVID deniers or COVID dissidents across our country level sample, so to speak. So we see that there is another country which reports similar level of similar numbers for COVID deniers, and this is Georgia. Then we have Greece with significantly smaller numbers of deniers, which amounts to 17-18%. Then we have Austria, Brazil, another country with COVID dissidents, but actually their president is a COVID dissident. Then Germany, South Korea, Japan, United Kingdom, and finally Sweden, which is again a very special case with only 2% of those who deny the existence of COVID as a real thing. And Russia actually has the highest number. But again, if we had the full sample of all countries in the world, perhaps Russia wouldn't have been a unique case, but this is the situation so far. So who are the COVID dissidents? And this is the beginning of the second series of our saga. So we actually were very interested. So who are these people? Are these people more religious? Because the first hunch that actually we had, it was a situation, a scandalous story in the Sverdlovskaya Oblast when one religious activist, Sergei, actually occupied the women's monastery, and they proclaimed literally like a religious sect there, and they clearly denied COVID, and there were several cases reported of COVID cases of COVID, even deaths in the monastery. So, and the whole story ended up quite badly. That was our first hunch. Maybe religious people tend to be actually more active, denying the existence of coronavirus. But in the end, we were quite puzzled by the results, and here we are. So just to give you some numbers before I show you some pictures. So in terms of gender distribution, so there are no clear differences. So the share of COVID dissidents among males is 41%, and among females is 36%. When it comes to the age differences, again, the mean age for COVID dissidents is about 44.9, 45 years, compared to the rest of the population, where the mean age is 46.2. So again, no dramatic differences here. There are fewer skeptics among youth and older respondents, and more skeptics about those who are in between 25 and 60 years old. And you can easily guess that these are people who are actually represent the active people who are actively involved on labor market. So those who actually go to work. And young people, they tend to be students, and older people, they tend to be pensioners. So this is why actually the subjective costs of accepting the danger of COVID were relatively lower than for those actually whose living standards depended on their activities on labor markets. The fourth important interesting thing is that there are very mild differences in terms of higher education. So of course, I mean, another usual suspect, okay, COVID dissidents are people who are actually just undereducated, so to speak, which is partly true. So there are just 33% of COVID dissidents among those with high education, and we know that Russia has a pretty high number of people with high education compared to other countries. So, which is again the legacy of the Soviet education system. We do have 41.5% of COVID dissidents among those with incomplete secondary education, and 41% among those with complete secondary. Sorry, there is a typo. Secondary education. And again, most of our sample are people with higher education. There are some differences, so there is a small effect of education, but again, so the number of 33 looks pretty dramatic. There are somewhat less dissidents in St. Petersburg, and St. Petersburg is a very special place in Russia in terms of COVID impact, because actually it's one of the most densely populated urban area, but at the same time, so the medical infrastructure, healthcare infrastructure is much more outdated compared to Moscow. Basically, it's roughly the same level of population density, but the quality of healthcare system is not as high as in Moscow. So this is why it ended up in a huge outbreak, a dramatic outbreak of COVID. And now, according to the studies of my colleagues from European University St. Petersburg, so there we can even talk about collective immunity in St. Petersburg due to these unfortunate circumstances. We do have 38% of COVID dissidents in Moscow and about 35-40% in smaller settlements. When it comes to the immediate experience of COVID, so those who experience COVID-19 themselves or their family members experienced it. So again, there is a clear difference. So if someone actually faced with that, so they report 13%, so the share of COVID dissidents, is 13% versus the 39% in the rest of the population. And finally, we found no significant differences by income, household size, number of children, and marital status. So again, so here we were acting pretty much theoretically. So we read the literature at hand. So then we realized that the closest literature we have is the anti-vax activists. So then we also contacted people who actually study HIV dissidents, so which is also a very specific group in Russia. So, and we try to combine this literature and evidence from previous research and see are there any parallels. But again, I can elaborate on that later on during Q&A. So, and as promised, some pictures. So again, in terms of age, we see no clear difference. So there is some gap between those who actually between, as I said, 25 and 16 years old. But then again, the differences are not statistically significant. In terms of gender, the distribution looks like that. So the number of dissidents among females is lower. And when it comes to actually something I didn't mention, health-related anxiety, the people who actually did not experience COVID, but they are afraid of it, so or they're afraid for their family members. And we see a clear correlation between those who are anxious about COVID and its consequences, and the degree to which they can. The share of people who who manifest themselves as COVID dissidents. So, and this is exactly the opposite pattern among those who actually report lower levels of anxiety. Again, so simply put, those who are afraid of COVID, so they tend to be, they do believe in COVID, obviously, and those who are not afraid, so they just don't think that it's a real thing. So it's pretty self-evident. And these are the distribution. This is the distribution for the COVID experience, and so these are the number I already mentioned. And a negative economic experience again. So those who actually reported negative economic events, the number of COVID dissidents among them is somewhat higher. So again, we can make some connections between negative economic events and COVID denialism, but again, it does not seem to translate into political support. And again, some distributions for the type of settlement. So as I mentioned, the lowest number of COVID dissidents is observed in St. Petersburg. So when it comes to other types of settlements, so it's, again, there is no clear-cut pattern. Another important thing, actually, I haven't mentioned so far is actually how trust in traditional media and consumption of media is related to these COVID denialism. And here again, so we've been acting theoretically. We just basically took almost all our variables and tried to actually make cross tabulations and calculate correlations. That was the idea, because again, the lack of coherent theory behind leaves us with this experimentation. And another interesting finding is that the trust in traditional media also has a strong correlation with the extent to which people tend to be tend to deny COVID as a real thing. The share of COVID dissidents among those who do trust traditional media is the lowest. So it's, as you can see, the blue bar, it's just 18.9%. And it's pretty high among those who do believe that the COVID is a real thing, and actually they tend to consume and trust traditional media. And by traditional media, we code it here print media and television. And non-traditional media are Twitter, Facebook, social media, and things like that. So basically internet. So, and those who do not trust traditional media and tend to actually receive the news from elsewhere, from social media, for example, the number of COVID dissidents is significantly higher. So what it means, I think it's pretty obvious. So those people who do not trust official media, who don't trust official institutions, so they tend to actually, they pick the different pieces of information from the sources they trust, maybe their local communities or social networks or word of mouth. So this is something we do not know based on our data, but something we can deduce. So, and the overall picture we see here is that the sheer lack of trust to anything which is official and anything which is affiliated with the state tends to actually correlate with the share of COVID denialists. If we try to come up with the social political traits or personal characteristics, or portrait of a typical COVID denialist. So basically, we'll see pretty average people, pretty much average Russian citizen, but with a number of interesting traits. We do have a number of variables in our survey which corresponds to the Big Five approach, Big Five personal traits theory, and we also have Shalom Schwartz values apart from the World Value Survey. Traditional set of values we measure. So, and if to make a long story short, so the main findings are as follows. So these people tend to be, surprise, surprise, less conformist. So they are more open to new experience and changes, and they tend to be more hedonistic. When it comes to other societal features, so these people are significantly less proud of their country. So these are not crazy patriots who are just, running with the flags everywhere. That's not true. These people actually are not more religious or less religious. They demonstrate less of a solidarity with the rest of the population. So they tend to be more distrustful and less anxious about COVID and other negative events in general. Another interesting thing, they are more suspicious of globalization, cooperation with other countries and migrants. So basically, they do not trust any representative outgroups. And finally, they report lower trust in traditional media and much, much less political trust compared to the rest of the population. So if we try to come up with a coherent story, so these people are not crazy anti-science, representative of anti-science movement or a sect. So, and my interpretation of this finding is that perhaps these people are kind of result of the post hoc rationalization. So, pandemic put almost all of the population and the citizens in pretty much any country in a very uneasy situation. So, and some people actually decided not to be quarantined and not to comply with these restricting rules because it would actually go against their economic well-being and even subjective well-being. So this is why these people actually post hoc rationalizing kind of justified their behavior, their non-compliant behavior, by the fact that this virus is does not exist, it's not real, or it's just not as dangerous as many people actually deem. So what do we know so far? So we observe a relatively small effect of the pandemic on the political support. So there is no straight effect, direct effect. Secondly, there is no rallying around effect. Thirdly, there is unusual association, which actually does not seem that unusual anymore. I hope, for me at least, and I hope actually I try to also kind of, I try to explain my vision of the situation, so in the way I interpret this. But I'm sure it's not the only way to do that. So there's an unusual association between COVID skepticism and political support. And again, conspiracy theories are popular everywhere, although the share of dissidents in Russia is significantly higher than in any other place. So this is something that, again, leaves us with a real puzzle. And finally, there is a connection to the media consumption, which can actually serve as a mediator between political support and lack of political trust and COVID's denialism. So how this causal mechanism looks like, this is again something we are working on right now, and we decided to continue with the mixed methods research. So, and we all invited our colleagues who are working with HIV skeptics and dissidents actually to come up with this, to make connections between personal traits, between a lower trust, beliefs in conspiracy theories, and political attitudes. Again, so this puzzle looks much more interesting than we thought in the beginning, and I hope you also were, if not puzzled, but at least was interesting for you to look at our results. And I'm more than happy to come and answer any questions, and I'm looking forward to the discussion. Thank you so much for your attention.
Thank you very much, Margarita. This was indeed extremely interesting. And now I would like to invite Anna to give her comments. Anna, please, the floor is yours.
Thank you. So good afternoon, everybody. First of all, I would like to thank you for inviting me to participate in the discussion of this extremely interesting research that Rita represented. So I have actually several issues to raise, and I think, I don't know if it would be helpful to go first of all to the slide where this COVID denialists are measured. I mean, with the question that was posed. This is the first kind of issues that I would like to discuss and maybe suggest some interpretation. Rita, would you? Yes, thank you. Yeah. So this is actually the first thing that I would like to raise and discuss a little bit. So the question with which the research actually tries to grasp those groups that deny this COVID. So in the question itself, we see kind of two parts. First part is about the Rita, I think maybe another one where not about the political support, but about the, yes, measuring COVID skepticism. Yes, exactly. Thank you. So I just would like, thinking about this category, I was wondering if we actually have kind of two questions here in one. So on one hand, we ask people about their interpretation of this hoax, which is widespread in social media, and on the other hand, we kind of try to ask them about their attitude about the lockdown measures. I mean, the evaluation of the activity of the governments themselves. So I see that the question in the end, it refers to the first part. I mean, I actually asking whether this story is not the lockdown measures, but stories in mass media, is in social media actually I evaluated how people feel about them. But so my question is, I understand that this is the question that was designed and posed, not maybe by you personally, of course, but a big research team. So I wonder if we need to play a little bit with these results and try to see if maybe there are two groups inside this group, like those people who actually evaluate these lockdown measures and they don't like it at all, and those who actually look at those social media and exactly see the stories that you are referring to here in the question itself. So first of all, this is the kind of first impression of this question and this group. So I wonder if we have two groups here of those people who are denying and those who are just fed up with these restrictions, with this measures introduced by regional governments. So this is actually important and interesting also to see further when we are talking about political support. I actually would like to add here, do you think that, kind of small question, do you think that those people who actually do not use this social media but still deny COVID, do you think they actually now cannot be grasped by this question? I mean, those who just don't know a lot about this stories about this hoax in the social media, but they do find this actually in TV channels, because we know that TV channels actually, especially in the beginning of the pandemic situation in Russia, they actually provided some hoax stories about the and offered people some explanations of where this whole pandemic comes from. So this is the first question. Just maybe look a little bit critical. Of course, I understand that we cannot change this, but maybe we need to a little bit add some interpretations to that. So this is the first. Second would be about the second question, or my kind of suggestion would be to see whether this COVID skepticism is indeed a part of the broader phenomenon. I mean, if it is related to this lower political support, and as your first graph with the decline of the political support generally in Russia demonstrates, maybe actually this pandemic situation is not unique. I'm kind of supporting you here with some ideas, because it seems that official position again of the mass media of Russian Federation is the following. So it's not actually too bad, and the COVID dissidents could kind of relate themselves to this position. And if we stretch further a little bit, this tendency that you demonstrated in the very, very first slide with this decline of the political support. So maybe we just see that this is what is going on. I mean, further. I mean, this kind of tendency. Then I would like to move towards this political support and those. The interpretation that you gave us with regard to the confidence in government. Maybe first of all, I would like to ask if there was a specification about what kind of government people were asked about, because of course we know that in Russian Federation this is important, especially in the times of COVID pandemic, that national governments, regional governments were, of course, experience all kinds of responsibilities that they had to actually deal with the pandemic. And as we know, Federal Center decided that now regional authorities and regional governors and governments actually are now should respond to this disaster on their own. So first, I just wish to ask, though I read the paper itself, I wasn't sure if I actually found this, but that the question about political trust, about the government, were specified somehow about what kind of government we are talking about. Also, in relation to that, I would like to ask, so if people actually evaluated their attitude or their political trust towards the regional governments, I would assume, especially if in the question we have these lockdown measures, they were introduced by regional governments, not the federal one, right? So I assume that people might think that they actually evaluated regional governors. And here, if this is the case, and people were thinking, though we need to actually take a look at the table, because you have 4 different criteria how you measure political support. Anyway, it would be important to see whether actually this is just this blame attribution that we are witnessing. So those people who are fed up with these lockdown measures, they have in mind that this is about regional authorities and governments. So, and they actually blame regional governors for this kind of measures. So can we actually interpret in this way this kind of lower level of political support of those people who answered positively to this question? Second, concerning the president of Russian Federation. So that was the beginning of June, right? So I just would like to bring this political context to the discussion, because we know that the president of Russian Federation was very positive about the situation with pandemic, and TV channels were very much saying that we actually won the war, relating this kind of issue of pandemic to the 75th anniversary of the Great Patriotic War. You remember all these kind of discourses about that. So that was the kind of the context. But we see that in the political support which is measured, the president is absent. So it seems that we are asking about political support, but without actually asking about the central political actor. Again, I understand the limitations of the research and the particularity of Russian case, because it's not everywhere in other countries which are in the analysis that the president actually is the central political actor. But this is the case when we are talking about Russia. So I wonder, again, coming back to this elaboration with regard to the blame attribution to this regional governors and maybe national government itself, could it be so that actually we have this blame attribution and we don't actually witness how this main beneficiary got this kind of support with rally around the flag? Because your interpretation is that we actually do not see this effect of this rally because we don't see actually this high support. But we actually don't see any support for the president in this research, right? But we might assume that the president was the key beneficiary of this situation, and actually blame attribution and rally around the flag is there. But maybe we need to play somehow again with the data we have in order to check whether this is the case. So this is the second pool of kind of issues and questions that I have. And finally, I hope I don't keep too much time, just to conclude, talking about the portrait of those COVID denialists. I wonder, I mean, those features that you attribute to those people, I wonder if they actually remind us or can this portrait can refer to this conservative turn and conservative people, a number of conservative people who share conservative values in Russia, and I'm actually here referring to the research of World Value Survey, the last very recent wave that we have. As far as I understand this, the trend of the Russian population in terms of values is exactly towards this conservative, traditional. I mean, just give me a second, I will check. So we have this traditional values more present in Russian society, and also this those that actually share these survival values, right? So we have this this theoretical framework that is underlying this the whole project itself, and it seems that it is related to this portrait that you described. So you're saying that those people, they actually anti-globalists, they don't share actually much solidarity with other people. So there's this high level of depersonalized trust, so etc. So it indeed reminds me about this bonding social capital that is shared by those people who can be treated as those COVID dissidents. So my question here would be whether you would follow this line of the interpretation. So do we have here this conservative turn and this the presence of it? Yes, I guess I can stop here. And again, thanks a lot for inviting to this extremely interesting discussion. And I would be happy to participate further in the discussion itself. Thank you.
Thank you so much, Anna, for raising these excellent points. Margarita, would you like to respond to some of them immediately?
Oh, I'll try to maybe walk through the because Anna, thank you so much for your comments. So it seems that you read the paper very attentively, and just very briefly. So and maybe I will skip some points and maybe I will raise them again during the this discussion. So About the question, so yes, it's not perfect. Actually, it's much far from what we actually would prefer to have, but we decided to add another battery of questions in the second wave, actually to specify different types of denialism. So those who do not believe in virus itself, those who kind of believe in their virus, but they think it has artificial origins, those people who actually think, yes, there is a virus, but it's not dangerous, and things like that, as to, differentiate between this, 50 shades of denialism. About those who actually do not consume social media and who actually watch TV and traditional media, but at the same time, they still tend to deny the existence, deny the realities of coronavirus. So this is interesting. It's kind of counterintuitive. My interpretation is that Russians, when it comes to self-reported measures about the media consumption, so they are extremely unreliable, especially in the Russian context, because people tend to underreport the extent to which they watch TV. So it's quite similar to the American studies when people tend to overestimate the electoral turnout because it's perceived as a kind of a civic virtue. And in Russia, actually, the civic virtue is that I hate television, but I still keep watching it. So it's like a shameful activity, so to speak. When it comes to the blame game, absolutely. So when we asked about the government, so we just asked, we use the word government consistently throughout all the countries we have in this wave. Of course, the degree to which the government plays a role in imposing lockdown measures varies significantly, from South Korea to Russia and from Brazil to the UK. And we might see some confusion evaluation, but again, here we do not compare political support and the effectiveness in a straightforward manner. So I do not provide these numbers. So this is why I think you're right. So these measures are not completely comparable across countries. So especially given the situation when in Russia lockdown measures were imposed by regional governments. So, and this blame game actually is something which is already studied by Regina Smith, Gulnaz Sharafuddinova, and other colleagues. So this is something which is taken by another great team of researchers. So this is something we need to address, that's for sure. So, and basically we are interested, but we do not, again, we're not working with cross-country perspective here. This is why I think it's not that dramatic. So there's this inconsistencies for this particular research. What actually allows me to tell you that there is no rallying effect still, even if we do not have consistent information on the presidential support? First of all, we do have Levada's ratings again, so we can actually take a look at them. That's one thing. And second, so usually rallying effect has a spillover effect, so at least temporarily. So it tends to spread onto governmental supports. They do more parliamentary supports and other institutions. So at least a little bit. So, and this is something we do not observe. So this is why I kind of, speculate that there is no rallying effect, and I genuinely believe that there is none. And finally, about the conservative turn. Yes, these people do look like those who actually share survival values against those, fancy postmodernist pro-environmental values and things like that. Yes, but there is one important but. These people are no patriots, which is quite typical to those who share survival values. The second thing, they are open to new experience. So these actually people tend to, on the degree of personal traits, these are not conservative people. So which is very interesting, and they do reveal strong patterns of hedonistic behavior. So again, this is something which is not typical to those who actually would share survival values. So at least they think maybe they can prioritize work and things like that, over, pleasures. So, and these people do manifest some features of survival values patterns. So again, these people are just different in terms of how autarkic, how isolated they are. But in terms of their everyday life behavior, it seems that they're pretty much, people, open-minded people, ready to experiment and things like that. So they do not look like conservatives in the sense you described it. So, and this actually leaves us with the evidence that these are just normal people. So just normal people, normal consumers. I'll stop here, so I have much more, but thank you, Anna. That was that was great.
Thanks a lot.